Lovely. So I've just hit record. If you're not able to stay tuned in this entire time tonight, we are sending out the recording probably tomorrow. If not later this week, I promise it will come from Integrative. You'll get a lovely email there. But I am going to, what time is it here? Okay, give everybody like one more minute to hop on. And I just want to double check. Okay. And how's everyone's night going? Is everyone having a pretty easy night? How was everybody's work day? You can either give me like a thumbs up, good, meh, so. What's everybody's, focus like tonight? Do we need to kick up some energy, or is everybody feeling pretty pumped and ready to go? I'm going to say you're all pumped, even though no one's responding to my question. Just so you know as well, excited for this talk. Thank you. Just so you know as well, in the drop down, if you're not comfortable putting your question out for everybody to see, you can just, in that chat option, you can send it directly to me. It might be set up as Carmen or Integrative. I think it's Integrative. But just send it directly to me, and then that means I'm the only one that's going to see that question. I'm the only one who sees who it's coming from. And when I ask it or kind of propose it to the group afterward, it will be anonymous. If you want, though, you're more than welcome to put it out to everybody. So I think it's time we can get us started here. I'm pretty excited to be chatting about this tonight because it is honestly the reason I ended up getting into nutrition to begin with. I find that women's menstrual health is a topic that is being more and more discussed, which is absolutely amazing. Because I think, I look back at my own journey as a teen, and what I knew then and what the information I had access to then was so different than what teenagers nowadays have access to. And I will say, with the scope of who is actually on this webinar tonight or who is registered for the webinar, we have people from across the board. So we have people that are, kind of in their fertility journey. Maybe they're having some hormone issues at a younger age, all the way up to kind of that late stage perimenopause and then postmenopause. So I'm going to try to cover as much as I can, but please know that, the menstrual cycle is such there's so much that happens within it, within those like 30 years, 40 years of actually having a period. So there's only so much I can really dive into. If you have specific questions, obviously, like I said, put it in the chat. Otherwise, we might need to kind of take it offline. But let's dive right in. So a little bit about me. If you haven't met me yet, my name is Rhiannon. I am the Registered Holistic Nutritionist at Integrative. I've been around for, I think, since 2019, let's say. And I'm typically right now in office on Mondays and Thursdays. I also do virtuals on Wednesdays. So I'm typically at home chatting to people online. But I really look at taking a full circle approach to hormone health. And that's why we're having this kind of holistic approach talk tonight, because when we're talking about our hormones, it's never like a one size fits all. And it's also never a one thing is the fix. We need to look at so many different factors. When we're talking tonight, we are, of course, because I do nutrition, we are really going to dive into the dietary piece, lifestyle piece. I personally, like I said, got into nutrition because of my own hormone journey. I had irregular periods, severe mood swings. I always apologize to my parents whenever I do these because they dealt with the brunt of my mood swings during those times. Cystic acne, painful periods, energy lulls, brain fog, like you name it. And you have potentially been there if you were in this conversation right now. And these are also issues that I see with my clients every day, especially when fertility becomes a problem. So there's a lot of people that I will see that for many, many, many years, they have had hormonal issues, painful cramping, brain fog, severe fatigue, breast tenderness, all these things, and it's been passed off as normal. And then when it comes to us trying to get pregnant, we're starting to see issues pop up. For other people, it's in that kind of late stage perimenopause or menopause where we're trying to get a hold of our symptoms. We're trying to get a hold of the hot flashes, the night sweats, the mood swings, the low sex drive. And we actually can then kind of backtrack and go, oh, like my period was terrible. Like I had really, looking back, I had obvious symptoms of hormone imbalance that are now kind of following me. So through this webinar, we're going to talk about how you're going to master those hormones. We're going to talk about fertility, support everyday energy, and then focus on some extra stuff too. Now, I will tell you right now, my goal is to keep this under an hour. I am hoping to have you out of here, questions included, no later than just after 8. That said, I've never successfully done that in the past. We end up chatting in the after question period, or I just have a lot to say, but I have run through this and I think we can maybe do it in about an hour. So here's what we're going to go through tonight. Your period phases. I know that this may be old news for some people. However, a lot of people actually haven't been taught this. We didn't know it back in school. We don't know it now. Some common symptoms that are around your menstrual cycle that are not considered normal, well, that are considered normal, but should not be. Common menstrual health conditions. So these are those big conditions that people are dealing with. The reason I like to talk about these, especially in the context of a webinar where people are looking at hormone support, is the fact that we may have some of these symptoms or a lot of the symptoms that are associated with certain menstrual health conditions. But we brought it to our GP, we brought it to a doctor, whoever it may be, and they've just been passed off as normal. So I want to kind of bucket some of these out. And if you're like, this is really sounding like my story, you have a little bit more to kind of back you up, bring into whoever you're seeing. Likely, if you're seeing one of the NDs at Integrative, you already have the support that you need. But if you're really working with like a GP sometimes, you need a little bit more to just back it up and be like, I need more support here. We are going to dive into perimenopause. I think a lot of the people here, just from talking to the team that is kind of going through who has signed up, there's a lot of people in that perimenopause phase of life. So kind of that mid to late 30s to late 40s, early 50s. Then we are obviously going to dive into dietary approaches. We're going to touch into some lifestyle recommendation and then some alternative modalities. The one thing I do want to note when I talk about alternative modalities, and not even necessarily alternative, but keep your eyes out for the emails that you're going to get after this webinar. So everybody who has signed up will get the recording of this. We also have a really good webinar, or not webinar, little short video to share from our ND, Dr. Jordan Dutton, who focuses a lot on pelvic floor health. And you can't really have the conversation about menstrual health without having that conversation as well. I am no expert in pelvic floor health. I have, aside from going to see a physio kind of during pregnancy, but she is a go-to for any of that. So there's a great little video coming your way later. So do make sure you're checking those emails. Oh, went a little bit too far back, 4 forward. Okay, so a little reminder. Some of the hormone symptoms that you may be having are considered normal are actually not. They may be common. The cramps, the headaches, the breast tenderness. They're very common. Doesn't necessarily mean they're all normal. Before we dive in here, I'm just going to take a quick check on the chat to make sure we don't have anything that's missing. Okay, and I'm just going to try and move. I think you guys have to see a little bit on the side with the Zoom piece, so I do apologize for that. I'm just trying to make sure that everybody can see the text more than anything else. You don't need to see the photos. So let's talk about our period phases. I really like to talk about this in the sense of, okay, we have our 4 seasons of our menstrual cycle, our period, our follicular phase, ovulatory phase, and our luteal phase. And these really equate to the seasons of the world. So when we're looking at our period, so we always consider the period. So the first day of your bleeding is day 1 of a new cycle. This kind of is equated to the winter. You think about it. It's that time where you really would rather be cozied on the couch with a cup of tea, maybe a heating pad, some good shows. You don't really want to talk. You really would rather spend your evenings indoors, and going out just seems like a big drag. When we're talking about what's normal for a period, we want this lasting 3 to 7-ish days, and you should have 1 to 2 days of bright red bleeding. Now, I have a lot of clients that I talk to that are in that time of their life where, maybe we are early 20s or early to like early 20s, mid 30s, not trying to conceive. Maybe we've already had children. We're like, you know what? My period is now like 2 to 3 days long, and it's really like light. It's so great. I love that that's happening. While it may be convenient, it is not something we can just ignore. That probably means that there's some hormone things going on that we want to address. So checking that you aren't having those like bright red bleeding days, but we're going to talk about a little bit more what too much looks like as well. So the follicular phase, we equate this kind of with that springtime. If you think about it again, 2 to 3 days after you've started bleeding. For some, it's a little bit more, 4 to 5 days. You're kind of thinking, okay, I'm feeling more energized. I don't want to just lay on the couch. I want to go out sometimes a little bit more. My physical activity is starting to ramp up again. I'm not as hungry all the time. So this is when our body is also preparing to release that egg. We're seeing an increase in estrogen, and that's typically associated with that increased energy. Ovulatory phase, it occurs somewhere near the middle of our menstrual cycle. It's at least 10 days before our next period. So if you have an irregular cycle, if you have a long cycle or a short cycle, you're looking for it to at least be 10 days before your next period. Usually it's about 12 to 16 days. Is that normal? This is marked by a spike in your luteinizing hormone, and then we're kind of going on from there. And we're going to see a drop in estrogen later on, and then an increase in progesterone as well. Both eventually drop off when we get to our actual period. Luteal phase, so this is the second half of your cycle. This is what comes after we ovulate. That is increased, or that is marked by that increase in progesterone I just mentioned. This is kind of that fall time. So when I say your ovulatory phase, and I say that's more like summer, think about how you feel during summer, how you feel when you're ovulating. You're a little bit more spicy, you're chatty, you want to be out, you want to put on cute clothes, you want to maybe exercise more. That all is kind of associated with that ovulatory phase. Your luteal phase, like I mentioned, is that second half. So this is that lead up to your period. Your whole body is just trying to make a baby. That is what it's anticipating. It's expecting that you are about to house another human. So typically we're starting to see an increase in our appetite. A lot of people are going for like heavier foods. If you're someone that fasts, I'm going to talk about this later. Maybe you want to start increasing more food earlier on because you're just so hungry all the time. When you think about fall, we start to kind of ground down. We ground down. We want more root vegetables, soups, cozy foods, less of those like lighter, fresh foods. So just a quick overview of kind of how our hormones work throughout the cycle. And when I say this, this is what's happening for somebody in their reproductive years. If you are post-menopause, this is not happening at all. Okay. Our estrogen, our progesterone, we're all kind of, it's not happening at this level. You're often seeing that estrogen is decreased significantly. Progesterone is doing some other stuff. And then when we are also in that perimenopause phase, this is not necessarily your typical cycle as well. When you are in that late stage perimenopause, you may start having progesterone and estrogen spiking and dropping more often. This is when we're going to want to talk to like our ND. We're going to want to talk to our naturopathic doctor. Make sure that we are on any kind of additional supportive hormones if we need, or taking additional measures like doing, sometimes people will have doing the IV therapy in the clinic. Sometimes we'll utilize the lab and do different drips to kind of support that. Okay. A little bit more detail for you. I'm going to try and pop this down up to the bottom now. There we go. So this is some information that you should have learned when you were in high school. So if you have kids, if you have grandkids, this is great information to share with them. If they are, at the early stages of puberty, just getting their period, this is a great time to have this conversation, because I've had this conversation with a lot of my younger clients, and they just don't know. Okay. Like, we're not taught necessarily about our cycle. We're not necessarily taught about how to track our cycle outside of, using an app, which if we were using that for, If we're using it just to kind of understand when we might get our period, great. If someone is not on some kind of contraception, it is really important that we're understanding our ovulation. So first off, we need to know that not everyone is going to have a 28-day cycle. If you have been here, you probably already know that, there's a range of what's going to be normal. Most of my clients will probably range somewhere between like 28 to 35 days. Where we want to be kind of aware is if you're on that like 40 plus, or you're having super irregular cycles. Ovulation isn't always going to happen in the middle of our cycle. So as I mentioned before, you're looking at ovulation happening about 12 to 16 days before you're going to get your period. So if you are having 35-day cycles, you're looking at what? My math is not great right now. Let's say like 19 to 25-ish days is when you're going to be ovulating. That is not even close to the middle of your cycle. So we can't always rely on that as just like your benchmark. So if you are someone who's trying to conceive, you really need to know what your period is looking like and to be able to backtrack on that. Like I just mentioned, ovulation should happen 12 to 16 days before you get your next period. Your period can vary by about 5 days without any concern, okay? If you're getting your period someday between day 28 and 33 every month, I'm not super stressed about that. If we're looking at, having a 35-day cycle and then a 25-day cycle and then a 40-day cycle, and it's kind of all over the map, we want to be looking into that. You cannot get pregnant every day of your cycle. If you have tried to conceive, you know that this is true. You know that there's about a 5-day window of possibility. And that's because healthy sperm, can live up to 5 days. You can truly only have that 1 day of your cycle that's really that like ovulatory day. The birth control pill suppresses ovulation. So the reason I always highlight this is because, as I mentioned in this next point, ovulatory cycles help to prevent things like osteoporosis, stroke, dementia, heart disease, and breast cancer. I am fully supportive of the birth control pill being used for contraception. It is an important part of life, and it is very necessary in many situations. But knowing that if you are not on the birth control pill and you're not trying to avoid pregnancy, having an ovulatory cycle can be really helpful for our long-term health, also for our general hormone health. You also want to have a few days of heavy and bright red blood, as I've already mentioned. I'm going to take a quick sip of my water here. Also, just quickly mute myself so you don't have to hear me swallow. Okay, let's go into an is this normal kind of Q&A. And you can even ask me in the chat if you don't see what your is this normal situation is. Feel free to put it in the chat. I will check at the end of this, and we can kind of touch base there too. So none of these are what we're considering normal. Let's just preface that. Irregular or missing periods, while it does become more common through late stage menopause, and it can happen a couple times a year. So if you're kind of having an irregular or missed cycle 1 to 2 times a year at most, because of really high stress, because you've been ill, because you're not sleeping really well, because you had a change in your diet, all of those things can cause irregular or missing periods. But again, if that's happening consistently, that's something we want to look into. Having an anovulatory cycle without the use of a pill. So that is a cycle where you are not ovulating. Early perimenopause symptoms, while it can be genetic, and that we can definitely look at it as a genetic factor, you also want to be looking at your lifestyle and your dietary approaches as well to see what may be able to be changed, so that some of these early perimenopause symptoms can be pushed off a little bit longer. When I'm talking early, I'm talking like early 30s. A lot of people should be kind of going into that perimenopause phase in their early 40s. Some people are kind of late 30s time, but often we want to be looking at it, especially if we're in that early 30s. Extreme cramping, breast pain, back pain. If you are popping Advil like it is Tic Tacs, that is not great. If you are needing something more than over-the-counter pain medication, not great. We want to investigate. If your breast pain is so bad that you can barely like put a bra on or touch your breasts, back pain, same situation. We want to look into it. Cystic acne, especially when it's hormonally related. It can be dietary related, but for a lot of people, we're seeing cystic acne pop up on kind of a, a cyclical, a menstrual cycle basis. Heavy flow leading to changing your pads or tampons less than every 2 hours. You're having a longer than a 7-day bleed, or you're passing a clot that's larger than a quarter. Unexplained weight gain or inability to lose weight. And then male pattern baldness or hirsutism, which is male pattern hair growth. So think like chin hair, a really thick mustache, you're starting to get chest hair, back hair, those kind of things. Okay, I just want to check to see if there's any questions. No, we are still good. Okay, so let's dive into a couple of common menstrual health disorders here. Like I said before, I like to tackle these. I'm also going to do a quick time check. Oh, we are sailing, guys. This is great. I'm doing wonderful. A couple of common menstrual health disorders. Again, I say this because, you may be experiencing a lot of these symptoms, but have never actually had somebody say like, oh, this could be what's going on for you right now. So I'm just trying to move this little group of you guys. There we are. Perfect. Okay. So endometriosis is where I like to start because surprisingly enough, it's an estimated 7% of the Canadian population of female physiology or people that are getting their periods that have actually been or will be diagnosed with endometriosis. 7% is like a significant amount. That's like almost 1 in 10 people. It's a chronic disease where you're having your endometrial tissue, which should be inside your uterus, is growing places outside of the uterus. So, for example, your ovaries, pelvic area, on the bowel. A lot of people are having symptoms like endobelly, where they're really bloated. The pain is like really extreme and painful periods, abnormal, heavy menstrual flow, really painful intercourse, abdominal bloating. So I talked about that kind of endobelly feeling, nausea, fatigue, fertility issues, depression, anxiety. And for a lot of people, these symptoms get brushed off until we're not able to get pregnant. So there's people at like 20 years old that are having these extreme symptoms, and they're getting brushed off as normal or common or thrown the pill, what have you, without any further investigation. So if you're feeling like this, like definitely dive into something along those lines. Uterine fibroids. So uterine fibroids are actually quite common. 40 to 80% of people with a uterus will have fibroids. It usually includes or can include excessive or painful bleeding, bleeding between periods, fullness in your lower belly, frequent urination, painful intercourse, increased abdominal distension, and issues around urination. Now, the thing is with these uterine fibroids is even though such a significant amount of the population can potentially have them, they're not always causing symptoms. And they're not always problematic for people. So if they do have symptoms, sometimes they can be that like heavy menstrual bleeding, frequent urination, back pain, pain during sex. But sometimes with the smaller fibroids, you're not actually seeing any kind of issues pop up, or your symptoms are really like minimal. So it's not becoming a problematic. For those with very large ones, or sometimes, everybody deals with symptoms differently, we may need to be treating with medication or different types of surgery. PMDD. So this one I find very, very important to bring up because I'm noticing in my practice that it is becoming much more common. I don't know if it's just the rate at being diagnosed is a lot more common. If people are noticing it more, or they have actually heard about it, they're like, this is not cool. I don't like feeling this way. It's premenstrual dysphoric disorder. It's a severe form of PMS. Oftentimes for the clients that I'm seeing, this is really trending toward like cyclical depression almost. Really low mood, low motivation. Sometimes there's suicidal ideation, feelings of irritability, anger, major mood swings, cravings, trouble sleeping, the physical symptoms that come with PMS. So the breast pain, the cramping, all of those types of things. In this case, it is often our neurotransmitters and our hormones that may be playing a role. They haven't actually nailed down exactly what the cause is, but you can assume based on the fact that it is hormonally linked, And when we're looking at a lot of these symptoms, we are looking at our neurotransmitters like serotonin. In many cases, talking to your practitioner about supplementing. Some doctors will want to advise like SSRIs. At the base of it all, you definitely want to add the foundations of the nutrition and lifestyle pieces. When we talk about these foundational elements later, you'll see that they kind of cross over with almost every hormonal piece that we're talking about. So this is that piece of the puzzle that you want to have in check before we even think about supplementation, IV therapy, any of those other things. PCOS. So PCOS is actually another area that is becoming more and more common. Again, is it because the rates are increasing, or is it because our actual awareness and knowledge around it is increasing? Not sure. But I can definitely tell you that back in like when I was a teenager, my doctor was definitely throwing the pill my way versus like doing a lot of the tests that can be requested for now. When the adrenal glands or ovaries are in a physiologically female body are producing increased amounts of androgen, so that's those male hormones, then is considered normal. That's when we're looking at like a PCOS picture. In order to be diagnosed with PCOS, you do need to have specific blood work done. You do need to potentially have an ultrasound done to see if you have polycystic ovaries. But oftentimes we're looking for that increased androgen. Sometimes we're looking for insulin resistance issues or metabolic issues, diabetes, prediabetes, those kind of things. Oftentimes we're actually diagnosing this because of severely irregular menstrual cycles, acne or oily skin, inability to get pregnant, weight gain, so really unexplained weight gain, and an inability to lose weight. So even if you're really physically active, you're really struggling with actually losing the weight. Oftentimes people will start looking at PCOS, especially when we're pairing it with a couple of these things here too. Hirsutism or male pattern baldness, and then discolored skin patches. Some people also get skin tags too, because they can be associated with blood sugar dysregulation. But usually when we're talking about PCOS, it's never like one single one of these symptoms, it's a group of them. Okay, and where are we at timing wise now? Yeah, guys, I am like truly sailing through this. I'm so proud of myself. I have some chamomile tea so I can wind down a little bit after we have this chat. Okay, so let's dive into perimenopause, because I think a lot of the clients that I see right now are in this phase, and perimenopause spans such a long period. I like to equate it to like the reverse puberty, because if you think about it, what was happening during puberty, all of your hormones are kind of coming online. All your estrogen, your progesterone, your testosterone, everything is starting to fluctuate and find its balance. And we're going through these major mood swings and life crises and all of these things in adolescence. The same thing happens, but nearly in reverse, when we are talking about going into menopause. I'm also going to take a quick pause to apologize. My son may or may not come bursting in here at any point. My husband is on duty, and he's doing a great job, but just so you guys know, if he does, I do apologize in advance. Sometimes he's great, but he's also 2, so that explains a lot. So with perimenopause, we expect it to kind of be starting mid to late 30s, early 40s is more typical. It can be very chaotic for people. So I think about it when I was kind of going through puberty on my own, and my mom was also going through perimenopause at the exact same time. So if you have a child at home who is getting their period, and you are also going through these hormonal changes, you understand the chaos that can bring. The thing about perimenopause is we can often start mitigating some of those symptoms by addressing diet and lifestyle. So a lot of the symptoms that I'm talking about are going to be hot flashes, night sweats, breast tenderness, changes in PMS. So some people will get, who had never had PMS before, never had any kind of issues, or all of a sudden starting to get major cramping. They're starting to get that breast tenderness. They're starting to have those mood swings. Oftentimes it's very common for us to see that lower sex drive, fatigue, irregular cycles. Vaginal dryness and discomfort during sex. So that's kind of being paired with that low sex drive, often changes in those estrogen levels. Increase in frequency of urination or leaking pee, mood swings, 100%. I can talk to any of my clients that are going through this and know that mood swings are very common. Sleep disturbances, short-term memory issues, and trouble concentrating. The other piece that I also like to add here is sugar cravings. I have so many people that either A, are kind of in that late stage perimenopause or have just hit menopause, and all of a sudden they cannot control their sugar cravings. Okay. So I want to dive into what is normal and what we can expect during our different cycle phases. I'm just going to pop into the chat here. So somebody is asking if perimenopause is associated with fertility difficulties. 100% can be. As we start to age, sometimes we are having anovulatory cycles. Sometimes we are having irregular cycles. So it's harder to pin down when we may actually ovulate. So if you are starting to notice a lot of changes in your cycles, also your levels of your hormones do change. So sometimes if your progesterone is dropping, progesterone is really important for kind of keeping that baby healthy and safe once it's starting to actually implant. Then we definitely want to be, addressing that. So taking a better picture, like a better scope of what your hormones are looking like, whether or not we're using something like a Dutch test, which is kind of that 24-hour test. Sometimes we'll do a full month cycle test with the Dutch. Alternatively, doing blood work with your practitioner. Some of the practitioners will use muscle testing to kind of see where everything is at. So it's definitely important to kind of start looking at our hormones during that stage, especially if you're trying to conceive at the same time. But definitely not impossible. Like going through perimenopause, if you are still getting a cycle, there's definitely other things we can be doing too. So what is normal during our cycle phases? After ovulation, until around day 1 to 3 of our bleed, it is typical that we are experiencing an increase in our appetite, increased cravings for carbohydrates. So can I get you guys to just raise your hands if you guys know that, if you guys understand that feeling? So, maybe a week before your period, all of a sudden you wake up and you're starving, or you cannot control your hunger cravings, you cannot control your sugar cravings, any of that. I have a couple people. Okay, thank you. I can 100% attest to that. Whenever I ovulate, I know for a fact, even if I'm not tracking, that I have ovulated because I am starving. Like I can go an hour or two in the morning sometimes without eating. And as soon as I ovulate, it's like I wake up and I need eggs and I need like tons of protein, and it's clear. So this is very normal because number one, our caloric needs actually do increase quite a bit. And by quite a bit, I actually don't mean that much. I think it's about 100 or something calories. But from pre-ovulation, post-ovulation. But that increase in appetite can also often be mitigated by increasing our protein intake and increasing our slow carbohydrates. So the one thing that I always like to address in this conversation is because I do see a significant amount of clients that want support on their weight loss journey. And oftentimes they come in and they've been calorie restricting for so long. And they're like, I don't understand why, I can stay on track for 1/2 of my cycle. And then the week before my period, I can eat really well during the day. And then I come home and I absolutely binge, or I can't stop. Like I see a bakery and I have to stop and I get something all the time. That's normal. Okay. We need to start finding the balance of how you're eating pre-cycle versus how you're eating pre-ovulation versus how you're eating post-ovulation up until that bleed. Oftentimes we're looking at increasing that protein intake, so 20 to 30 grams of protein at every meal in that post-ovulation phase. You should be doing this actually pre-ovulation as well, but really focusing on it during that time and really focusing on slow carbohydrates. So when I say slow carbohydrates, I'm talking about the things that are high in fiber. I'm talking about the beans and legumes. I'm talking about the squashes, the starchy vegetables. I am talking about the whole grains, any of those things that are going to slow down digestion, to slow down how our blood sugar is spiking and how it is being absorbed and how our insulin responds. Because how our insulin then responds to major blood sugar spikes can impact our hormones overall. Make sense? Now, after our bleeding until ovulation, you might start experiencing decreases in appetites, and it's common for people to choose lighter foods or be able to fast. If you are somebody who really feels like they thrive on fasting, number one, depending on your phase, if you are trying to get pregnant, I don't want you fasting, okay? If you're kind of closing in on menopause, fasting may be a little bit more appropriate for you. If you are post-menopause, fasting may be more appropriate for you. But when we're looking at this, most people will find it easier to like fast during that first half of their cycle and then not fast during the second half, or at least a week before their period. They're typically able to choose those healthier options, quote unquote healthier options, or like lighter foods, smoothies, salads, those types of things, versus as we lead up to our period, normal for us to want those like really hearty meals. So some common dietary issues that can lead to reproductive problems, whether or not we're trying to get pregnant, whether or not it is that perimenopause, menopause symptoms, those types of things. Low fiber diets. So I just talked about slow carbohydrates. Those are all going to be really high fiber foods typically. On average, we are consuming about like 15 grams of protein at most a day. We want to be aiming for 25, 30 grams of 25, 30 grams of fiber per day. We're usually hitting about 15 grams of fiber per day. There's a huge gap there. Fiber is really important when we're talking about having better bowel movements, when we're talking about regulating our blood sugar, when we're talking about cholesterol management, like just overall health, we want to be adding fiber. When we're talking about our hormones, we're really wanting to support that bowel movement too, and also that blood sugar regulation. High sugar diets. So even those healthier sugars, sometimes you're dousing everything in maple syrup. If you are eating high carb meal after high carb meal and not expending that energy, oftentimes we're starting to see problems start arising because of that insulin spike and drop. And even I will say people that are like expending the energy but are having high carb diets, like I have a couple of clients that are endurance athletes. They are really high performing athletes, and they're needing to, kind of go from sugar rush to sugar rush for the energy for performance. However, when we're looking at their hormone picture, there's a lot of stuff that's going on there because we're kind of jumping from sugar to sugar to sugar. A diet that's high in ultra processed foods. Now, when I say ultra processed foods, I'm talking about the foods like the prepackaged ones that have 4 different types of food dyes and some type of synthetic fragrance and artificial ingredient. And you know what I'm talking about. The really like the Doritos of the world. What is not considered an ultra processed food, but is still a packaged food, things like, the quinoa, the dry quinoa on the shelf, the cans of beans. There is some form of processing that's happening there. It has to, but it's still like 1 to 3 ingredients that you can pronounce all of them. Those are not ultra processed foods. Do not stress about those. Oftentimes they are accessible and easy to use. Again, what we want to minimize is that fast food, those ones with like 20 different ingredients on them, the things that are really like deep fried all the time. Diet that is too low or too high in calories. So oftentimes, and especially when we talk about like fertility, I think there's this misconception that having a higher BMI is a negative indicator for fertility. However, also having a very low body mass, and I also don't typically go by body mass index. I'll use something like somebody's BMR score, so their basal metabolic rate. We're also just like generally looking at body mass of, how much is muscle, what do you look like those kind of things. If you are on a calorie restrictive diet for a very long time, your body is not feeling safe. Hormonally, we are not doing the things that we need to do. And so when I say this, I'm going to relate it back to fertility really quickly. But when your hormones are doing what they're supposed to be doing, that's always going to be an environment for fertility. That's always going to be things that make you feel better naturally, because that's what your body is trying to do. It is trying to conceive and hold on to a baby truly every cycle. So if you are in a space where you are good and fertile, usually a lot of our other hormonal issues are kind of quelled down a little bit. So if you're in a calorie restrictive space, there's no way a baby wants to come into that, because you do not have the energy for yourself, let alone to grow another human. So I often talk to clients when we're missing a period or when we're having irregular cycles, and we talk about our physical activity and we're talking about our caloric intake. Oftentimes that's playing a huge role. Like, we are not getting our period because we are going to 5 HIIT classes a week, and we are then, following that up with a cup of black coffee at 6 a.m. and then not eating till noon. These are all things that can contribute to long-term hormonal imbalance that are then going to create issues when we're talking about perimenopause, when we're talking about menopause. And someone did ask, and I'm just going to address it now, do your symptoms go away post-menopause? Yes and no. So a lot of people will notice that things like mood swings will start to die down. Hot flashes can take a while. Weight gain tends to be the common lingering one, and sugar cravings for a lot of people. So in that couple years after we've totally gotten rid of our period, a lot of people will notice that weight gain tends to be the biggest piece that they're dealing with after that. Okay, so common dietary issues. I know that I have dietary issues here, but I added in a little lifestyle piece. Exposure to endocrine disrupting chemicals. So endocrine disrupting chemicals are hormone disruptors. They are things that we may find in our candles, in shampoos, in our cleaning products, in some of our skincare items, in the plastic kitchen utensils that we're using, that can all create hormonal imbalance. And because we're being exposed to them on such a high frequency, so even though the amount that we are exposed to from that individual item may be small, if you think about every area in your life that you are exposed to endocrine disrupting chemicals, that makes for a significant impact. I'll make a quick note here. At the end, I've included a little QR code. So I have a downloadable fertility hormone guide that kind of dives into a little bit more of things to avoid and include when we're talking about cosmetics, kitchen, all that kind of stuff. So if you want more information on that, you can go and download that. Alternatively, I also recommend people use the Environmental Working Group's website. It's really accessible. It's pretty in-depth. It's not perfect, but it definitely has information there that can be really helpful for people if you don't want a guide, if you want to just check it every once in a while. Digestive issues. So if you are having problems like constipation, diarrhea, severe bloating, you're having heartburn regularly, digestive issues commonly are paired with hormone problems. So we want to get to the root of whatever's going on with your digestive system before we can really start tackling a lot of what's happening hormonally. Poor sleep quality and length. This is I have an Instagram post going out sometime next week. I don't really know when, but it's on your period problem starter pack. And this is a big one. Poor sleep quality, poor sleep length, and high stress. Huge pieces. Again, not dietary issues, more lifestyle factors. Sorry. But these ones wreak havoc. If you are getting less than 7 hours of sleep consistently, especially less than 6 hours, there's a lot of studies that show people on 6 hours of sleep over the course of, I can't remember how many nights it was, but it was not a lot of nights. They're truly in a sleep deficit, and they're not able to function at their normal basis. Their body is starting to take a hit. They're starting to notice the repercussions on these people's bodies by getting little sleep. Now, obviously, if you are listening and you are in your postpartum phase, there's not a heck of a lot that you can do about that. And I've been there, I get it. But know that once you are out of that and you can control sleep, we really need to prioritize that, okay? Stress as well. There is a couple things, I can't remember if I do this in an upcoming slide or not, but if I do, let's ignore it. And we're going to do this now just to make sure we tackle it. I want to talk more about stress because it's something that a lot of us see and we hear, and we are basically told, like, okay, you need to do these major hormone, or not hormone changes, you need to add these like major lifestyle shifts in order to balance your stress levels. You need to go to yoga classes, you need to meditate for 20 minutes every day, you need to see counselor. Yes, while I agree all of those things are absolutely amazing, especially the counseling, what we need to do is start having micro moments of stress management. Okay. So these micro moments can look like 1 minute of box breathing while you're sitting at your desk before you have a meal, or doing some horse lips before you have a really big meeting to regulate your nervous system. So nobody can see you right now. You can all see me. And what we're going to do is we're going to go through a couple of the things that I often recommend for my clients to do. So number one, I recommend some of these for kind of integrating your vagus nerve, which can actually help support what's called our rest and digest system. This is going to help with digestion. It's going to help with our hormone health, all of those great things. So number one is called horse lips. So you're just going to take a big deep breath. And then as you breathe out, you're going to blow out your mouth like. So everybody do that right now. Everybody take a deep breath in and breathe out. So if you are sitting alone in an office, you're sitting at your computer somewhere, you're going for a walk, there's no one really around you, try that. We really need to work on finding little moments to regulate our nervous system throughout the day. The second one is box breathing. This one, again, I recommend for people a couple minutes before a meal, before you have a meeting, post-meeting. Make it like at a time that you can remember. So as soon as you get in your car, you do this. Before you start your workday, at the end of your workday, whatever is that reminder for you. It's an easy, quick way to add it into your routine. So box breathing looks like breathing in for a count of 4 or 5 seconds. So everybody breathe in. You're filled up at the top, and you're going to hold it for that same amount of time. So let's do 4. 1, 2, 3, 4. Now we're all going to breathe out, same amount of time. 1, 2, 3, 4. And then we're going to hold it out. 1, 2, 3, 4. It's really hard to talk when you don't have any breath in you. So do that a couple times. Another one that I like to utilize is called the physiological sigh. So this one has actually been shown, and I don't know how many times you need to do it, but it has been shown to be more supportive than even sometimes a meditation practice. And this one is great because if you think about it, it's very similar to how a child ends a tantrum. So they're kicking, they're screaming, they're losing their mind, and then they're finally starting to come to, and they're like, right? If you know what I mean, you know what I mean. That's kind of what you're going to do. You're going to take a deep breath in, fill it up at the top as much as you can, and breathe out. So try that again. If you've done specific breathwork classes, you'll also recognize that, where they go, and you're doing that like on repetition until your whole body starts like seizing up and doing weird stuff. But we're only doing it for a couple breaths, so it feels still pretty good. Those are the 3 that I find really easy for people to integrate into their day. So trying those, see how it feels. And worst case, you don't have time for any of those, or you can't remember what I just said, deep belly breaths. Okay. Put it, little reminder in your calendar, every hour and a half, every hour, taking a breath beyond our chest, all the way down through our diaphragm and into our belly. So let's try that one all together. Breathe out through your mouth this time. And try it again, breathing through your nose and out through your nose. One may feel better than the other. Use whichever one you like. But this is my little reminder for you before you go to bed tonight, when you wake up in the morning, when you notice that you are feeling dysregulated. This is huge. So we go throughout our day and these little items pick up. And it can be something as small as dirty dishes in the sink. It can be a messy table. It can be our desk space is a mess. Mine is right now, and I don't like looking at it. It can be that our toddler has asked us for 5 different things within the span of 30 seconds. All of those things can set us up into more fight or flight mode, okay? We want to pick and choose these small little practices that help to regulate us during the day. Okay. Okay. There's a great question about timeline of everything that I'm going to address at the end because it is going to take me a minute. Time check. Ooh, yeah, this is where I start talking too much. Okay. Diet recommendations. So diet plays a major role in our overall hormone health. Okay. Like I said before, you don't want to be doing all of you don't want to be doing all of the frills. Okay. If you don't have the foundational elements, you're always going to keep going back to square one. It's a huge piece of the hormone puzzle. So the biggest pieces that I like to talk about: blood sugar balancing, increasing fiber, and reducing refined carbohydrates. We've talked a little bit about increasing fiber already. We're going to dive more into blood sugar regulation, reducing refined carbohydrates, which all of these last 3 go hand in hand. First, I'm going to talk about seed cycling. Seed cycling is a method that I often will recommend for people in perimenopause. However, people that are kind of anywhere in their reproductive cycle will typically use it. It's basically you're swapping between using a combination of flax and pumpkin seeds in the first half of your cycle, and then swapping over to sesame, sunflower seeds in the second half. You're using about a tablespoon ground of each. You do want freshly ground ideally. If you do not have a regular cycle, you can always use the moon cycle. So from, full moon or new moon to full moon to new moon, it's kind of your swapping times. Most people, like I mentioned, do find it really helpful during the perimenopause period. Our blood sugar balancing. So again, I talked already about blood sugar regulation, insulin, and how that can affect the rest of our hormones. What I really emphasize for people is starting off with a really blood sugar friendly breakfast. So that typically looks like 20 to 30 grams of protein. So this may be a scoop of protein powder. This may be, 2 eggs and some filler-free turkey sausage. This may be like 5 scoops. I think it's 5 tablespoons of hemp hearts. This may be like a half a cube of tofu scrambled up into a kind of like, scrambled tofu. This can be leftover protein from the night before's dinner. Whatever it looks like for you, you want to be aiming for 20 to 30 grams. We also want to stack up the fiber during this time. So in the sense of fiber, this can even be like leafy greens. This can be nuts and seeds. This can be, really low starch foods. I often will recommend people using carbs that are really either high in fiber, low overall, like kind of those refined carbohydrates. Sometimes people will just forego the carbs or like the general carbs altogether and do something like a big breakfast salad, or they'll do a smoothie that has a flavored protein powder, some avocado, some nuts and seeds, and then some spinach and a bunch of veggies and maybe some berries. Keeping carbs a little bit lower at breakfast. And then that typically helps to actually regulate our hunger and our blood sugar throughout the day, because what's happening is we're not spiking our blood sugar in the morning by consuming a ton of carbs. If you're someone that grabs a banana and a cup of black coffee and you're finding that you are starving from like lunch onward, or you can't seem to regulate those sugar cravings, this is a tip you want to tune into, okay? Or that's a tip you want to have tuned into. Because oftentimes what's happening is we're grabbing that blood sugar boosting banana, and then we're also grabbing that coffee that's going to kind of spike our cortisol up, and we just send everything flying up. And then our insulin is just trying to come and catch up, and we're on this like roller coaster the rest of the day. Versus when we're starting with that protein, fat, fiber heavy first meal, what's happening is we're actually regulating and slowing down that blood sugar spike And often people find it more of a merry-go-round than a roller coaster. So we're kind of just having a small spike that can be really well managed, and we're staying full until about lunch. And then we have our lunch, again, something really high in protein, some good slow carbohydrates, some good quality fats, amazing. And then we're increasing again at dinner. So this really helps to regulate ourselves during the day. Again, when I'm talking about cravings, when I'm talking about hormone support, all of those things. Refined carbohydrates, again, we want to reduce. In some cases, we want to completely remove them, especially if we're having significant perimenopause symptoms. Alternatively, if you're someone in that PCOS picture as well, something we want to be removing. Next, because again, like I said, I'm trying to keep us through here. A couple lifestyle recommendations. So outside of that stress management, I already talked about that high stress, unregulated nervous system piece, box breathing, horse lips. Humming is another one. Sorry, humming and singing, also really great. Humming right before a meal, singing right before a meal. I know it's kind of odd to like hum while you're sitting in your office, but consider it. Fitness is another piece that I like to talk about a lot. So too much or too little can be a huge problem for us when we're looking at our hormone picture. If we are super sedentary, if we wake up, we drive our car to the office, we are working all day behind a computer screen, we get home, we are sitting in front of the TV watching Netflix, not going to be ideal, okay? On the flip side of that, if you are waking up at 5 a.m. after going to bed at 11 o'clock at night and you are going to a high intensity spin class or some kind of like F45, some kind of really high intensity cardio, you're going for a 10K run every morning. And then we're either A, not fueling up, or B, in many cases, we're fueling up, but we're still under eating sometimes, or physically doing too much activity for our bodies to be able to handle, we'll start noticing period changes. Okay, we'll start noticing hormone shifts. We really want to focus on number one, if you love those things, we can find a place for them for sure. You probably want to work with somebody to figure out what's going on and where we can actually place them. But you want to take the time to focus on things like lifting heavy weights. You want to do some Pilates, some yoga, walking versus high intensity or extreme endurance. These all help to regulate our system. And for a lot of us, we're already living in these states of like really high stress, whether or not it is like work, family, emotional stress, or we're looking at high inflammation stress that's going on inside of our body. And then we're adding on to it by doing these really demanding physical activities. It can be too much for our hormones to deal with. So figuring out our balance is really important. Sleep. Get off your phone, purchase blackout curtains, listen to an audiobook, or try a meditation or something before bed. Quality sleep and quantity of sleep are both very important. And I find a lot of people will sleep better if we can add some kind of like blackout option there. Blackout option, noise canceling something. We're listening to white noise as you're falling asleep. Like I struggle now to go to sleep without a white noise machine, mainly because we used it when my son was in our bedroom. And then now I struggled when it's not on. So utilizing those things, especially if you're living in the city where you are getting that noise all the time, you need to drown it out somehow. Beauty and home products. So as I mentioned before, we really want to look at where we might be having endocrine disrupting chemicals coming into our life. Household cleaners, kitchen utensils, beauty products, all of them can be disrupting our hormone balance. And we want to swap those out as you can. So for some people, it depends on what it is. Some people will be like, I am doing a complete overhaul. What is more economical is to just finish the product that you have and start new. Okay. Again, Environmental Working Group has like all the different brands that you may want to get. Oftentimes I will tell people Detox Market is a really great place. If you are looking for like household cleaners, those kind of things, simply put, if you're doing cleaning stuff, baking soda, vinegar, water work wonders. Luckily, all of these things are like way more widely available than they used to be. Some alternative approaches. I think this is our last page. Yes, we did it. What time is it? Yes, we did it. Okay. Utilizing some of these additional approaches are going to be really imperative for some people when it comes to their hormone health. Depending on your life stage, your age, your doctor or myself, if you are seeing me, might speak to you about supplementation. Your doctor, like your ND, may speak to you about additional hormone support if you need that. And these are individualized approaches, and they should be targeted with your ND or myself, depending on what we're looking at, depending on what the testing recommendations show. This is because everybody has a different picture, okay? Everybody is going to be dealing with different hormone imbalances. And although your symptoms may say one thing, and that is really important to listen to your symptoms and acknowledge what's going on there, sometimes when we do testing, we're actually getting a different approach. So utilizing certain tests can be really beneficial, and actually getting the correct support. Now, things that are often easily done outside of that, acupuncture. So a lot of the NDs that are at Integrative, as well as our TCM doctor, Dr. Karen Lamb, will do acupuncture that can help to target the hormone issue that's specific to you. I absolutely love acupuncture. I have seen it work wonders for so many people. I have seen it help when we're talking about that fertility stuff. I have seen it help when we're talking about hormone regulation, hot flashes. If you are in perimenopause, a lot of people really rely on acupuncture to actually regulate their symptoms. So I really, really highly suggest looking at getting some acupuncture done. Pelvic floor support, again, like I mentioned before, you will be getting an email that is coming from Integrative, but Dr. Jordan Dutton has done a little kind of snippet on what pelvic floor health is, the importance, why you want to be looking at it, because there's a lot of symptoms that go on with hormonal dysregulation that are actually part of pelvic floor issues. Again, I am zero expert in this. All I know is what I have experienced in terms of seeing a pelvic floor therapist. But it is very important to also consider this as part of your therapeutic approach. Counseling. I always recommend, if you are dealing with stress management, if you're dealing with past trauma, whether or not it is big T, little t trauma, having some kind of therapy can be really important. If you are dealing with some major life trauma, I often will recommend people looking at something like EMDR, different types of more informed, like more trauma-informed approaches that aren't necessarily just talk therapy, because for some people, talk therapy and trauma just don't necessarily go together. Okay. So we get into the question period. As I mentioned earlier, the QR code there, if you want, it takes you to a little landing page. If you know how to use the QR code, you just open your phone, go into the camera setting, point it at the little picture. You can link it, and then you can just sign up there, and you'll get the download. It doesn't come up right away. You have to like register. I'm not that tech savvy to just have it pop up. But you can download that, and then you'll have a bit of an overview on kind of it's basically like a foundational guide. If you have anything else, Integrative NMC, so that is Integrative's all social media handles. And then Eating Between Lines is where I am if you have any questions you want to ask offline. The other place you can also reach Integrative nowadays, so Facebook and Instagram for sure, but LinkedIn is actually, they've been a lot more active there, I think. So you can always follow them there as well. So let's get into questions, guys. Okay. So how long does it usually take to improve after radically changing this kind of lifestyle? Poor sleep, high stress. I'm sure it depends on the person, but wanted to know if there's an expected timeline. This is a great question because it is something that I often will address with anyone that I am working on hormone health with. So when we are talking about that, I say minimum is going to be 3 months. The reason for this is because the egg that is going to be utilized in an upcoming pregnancy starts 3 months before that. Okay, so we're starting to see a lot of hormonal shifts that are going to be needing to go on over the course of about 3 months. And because a lot of the times that egg quality, all of those things can be impacted by our hormone health. So I always tell people give it about 3 months. Some things you will notice shifts right away. If you all of a sudden go from like sleeping 5 hours to 8 hours, you may notice within a month that life is like completely turned upside down for you. If you have been really high stress and you quit your job, I will say that's very unlikely for most people. It does take time, especially if we're dealing with like major burnout. But I say minimum amount is about 3 months. Okay. Can acupuncture help fertility? Yes, I have seen a lot of people, both in my personal circle, clients that have found a lot of support by going through acupuncture. Okay, what does progesterone do during perimenopause, and any dietary suggestions for this? Okay. When we're talking about progesterone is kind of that like calming, relaxing hormone that I often will talk to people about. So if you, and it, what can be dependent on is where your progesterone is beforehand. So oftentimes if people are deficient in progesterone before we're going into perimenopause, we're going to have some issues of progesterone deficiency continuing through that time as well. Dietary stuff for progesterone increasing, that one's always hard because I don't do specifically like just progesterone. A lot of it is just based around that hormone balance piece too. So again, blood sugar regulation, we want to talk a lot about that because cortisol, blood sugar management are both connected, and cortisol and progesterone also work together quite a bit. Cholesterol foods, important. So we don't necessarily want to be having like a crazy high cholesterol diet, but having foods like egg yolk, not avoiding animal fats, like 100% avoiding them. I don't want you downing red meat every single day. Those kind of things can be really helpful because what the precursor to all of our hormones is going to be cholesterol. Fun fact, should have put that in the info session at the beginning. I hope that kind of answers some of it. Can you share the symptoms of smaller fibroids again? For some people, there's zero symptoms for smaller fibroids. For some people, it's just minor cramping. For some people, you're starting to have that kind of bloating. It really depends. Can acupuncture help alleviate period cramps? Yes, yes. A lot of people have found support with acupuncture and period pain. I will say, again, you want to get to a lot of the root of that. Another thing that some people find can be really helpful is like there's a turmeric matrix that we have at the clinic that a lot of people are finding really helpful. But that can also be dependent on what you are, if there's any other medications that you're taking as well, and any other kind of like health conditions that you may have, because sometimes turmeric, I don't have people take. Okay. I know some people are experimenting with intermittent fasting to help with issues like high blood pressure. Does fasting help with hormones? Depends. So this is a fun thing about everything. Is it always just depends. For some people, fasting can be really helpful, especially if we are dealing with a lot of metabolic issues, if we are not underweight, if we are using it kind of cyclically. So again, maybe using it only in the first half of our cycle. For some people, if we are dealing with already really high stress, adding in fasting makes everything worse, because what ends up happening is when you fast, okay, so let me just backtrack a quick second. When you fast, and if you fasted before, you'll know what I'm talking about. What ends up happening is you like get this jolt of energy. People are really focused. They're really productive. This is why they like fasting. This is why they like fasting on a cup of black coffee, because we've done this and all of a sudden we're like brain power 500. The downside of that is that's because we're having that spike in our adrenaline, our cortisol, all of the things that need to be on and firing when we're in kind of a starvation mode. Now, so it has that short-term benefit, but for some people, if we are already dealing with like stress all the time, fasting is not going to be a great option for us. A lot of people will deal with fasting better post-menopause than while they are in those reproductive years. Okay. I think I kind of got everything. When we're talking, somebody asked about supplements and foods for increasing progesterone. I talked about some food stuff, but I will say supplement wise, and again, this is something you should be talking to your practitioner about first. Because I don't blanket recommend this for everyone. Vitex, so chaseberry, can be really helpful when we're talking about progesterone levels. Vitamin C overall, so vitamin C rich foods can also be really helpful for people too. Okay, I think those are all of the questions. If you have any additional questions like separately that you want to add, of course, feel free to message me. You can use my social media handle there. I will say I will probably answer you faster there than I do on my email. I don't know why I lose everything in my inbox somehow. So if you have any additional questions, of course, please let me know, and then hope to see you at some point in the clinic. I'm there, like I said, Mondays and Thursdays. So if you want to just say hi, tell me if you like the webinar, whatever you want, go for it. Otherwise, everyone will be getting a recording sometime this week. And yeah, if you need anything else from there, you'll be good. Have a wonderful evening, guys. I am going to stop sharing and then end this thing. So have a great night. Bye.